Today we're diving into the recent ransomware attack on Change Healthcare, a key player in the healthcare industry. We'll explore how ransomware attacks work, the timeline of events, and the broad implications of healthcare providers and patients globally. But first, what is ransomware and how does it work? Ransomware is a type of malicious software designed to block access to a computer system until a sum of money is paid. It usually begins with an email. Imagine you receive an email that looks like it's come from a friend or a company you trust. The email has an attachment or a link. You open up the attachment or the link and, well, you've unknowingly downloaded malicious software onto the computer. This malware installs itself quietly without you noticing. Once the malware is installed, it starts encrypting your files. Encryption is like putting your files into a locked box and you don't have the key. The files that are infected, encrypted documents such as photos and videos and other important files, making them entirely inaccessible to you. After your files are locked, a message will pop up onto your screen, and this is the ransom note. It tells you that your files are encrypted and you'll need to pay a ransom. Usually in digital currency like Bitcoin, to get the decryption key. The message often includes a deadline, adding the pressure to pay quickly. Now, you have two choices. You pay the ransom or try to recover your files through other means, and like backups or if you have any, or paying the ransom, which doesn't necessarily guarantee that you'll get your files back, or that the attackers might make your money and the information disappear entirely. If you do decide to pay the attackers, they might send you a decryption key. You'll use this key to decrypt your files, which means that unlocking the box to access your documents once again. However, there are consequences such as your financial loss. Paying the ransom can be expensive. The data breach, your personal information might be compromised. Or perhaps for future risks, the system might still be vulnerable to future attacks. Change Healthcare, one of the world's largest health payment processing companies, acts as a clearinghouse for about 15 billion medical claims each year, representing nearly 40% of all claims. On the 21st of February 2024, a ransomware attack knocked healthcare offline, creating a backlog in unpaid claims. This left doctors' offices and hospitals with a serious cash flow problem, threatening patients' access to care. Worst off is that it revealed that millions of Americans may have had sensitive information leaked onto the dark web, despite United Health paying the ransom. So let's look at the timeline of events. On the 21st of February 2024, the cyber attack occurs. Change Healthcare is hit by the ransomware attack, disrupting operations and payment processing. By late February 2024, the immediate impact is shown in hospitals and clinics, which face a significant cash flow issue due to unpaid claims, which affects patient care. By March of 2024, the information leaks. Reports emerge of sensitive healthcare information of millions of Americans may have been leaked onto the dark web. By April of 2024, the US government briefings in the Energy and Commerce Department begin with working with administrations in Change Healthcare to assist providers, especially smaller and rural practices. By the 17th of May 2024, the subcommittee hearings begin. The subcommittee on the healthcare convenes hearings to discuss the cybersecurity vulnerabilities in the healthcare sector and explore potential solutions. By June of 2024, the CEO is summoned of United Health. The CEO, Andrew Whitty, is called to explain the attack, response measures, and future prevention plans. The attack on Change Healthcare highlighted several critical vulnerabilities. Chief among these are the organization's role as a central hub for payments and billing processes, a fact well known to many chief information security officers. Despite this awareness, the necessary steps to mitigate these risks were not taken due to budget constraints and resource limitations. When the attack occurred in February of 2024, it resulted in a $22 million ransom payment to restore operations. This incident forced healthcare providers and pharmacies to dip into their limited cash reserves to maintain operations, significantly straining financial resources. The breach also compromised the personal data of 1/3 of Americans, triggering congressional hearings and a broader discussion about cybersecurity in healthcare. The Change Healthcare attack is not an isolated incident. Other breaches, such as those involving Kaiser Health and Accession, also compromised personal data, disrupting clinical operations. These incidences underscore the growing threat posed by ransomware groups, which have been identified as a significant danger to the healthcare sector. Ransomware attacks on healthcare systems are not confined to the United States. More recently, in the United Kingdom, Synovus, a pathology service provider, faced a very similar attack. The incident, which emerged on the 3rd of June 2024, disrupted IT systems and affected patient care across several NHS trusts and GP services across London. Let's have a look at the timeline. On the 3rd of June 2024, Synovus experiences a ransomware attack, significantly impacting pathology services and patient care. By the 4th of June 2024, a public statement is made by Synovus, confirming that the attack had occurred and the details that affected services and its initial response and efforts. An ongoing response with the NHS coordination, working together with Synovus to assess the impact to restore services, highlights the critical importance of a robust cybersecurity measure. As the UK still grapples with the impact on their healthcare system, over in the US, from the wake of the Change Healthcare attack, the Energy Commerce Committee has been proactive in addressing the issue. They brought together members and have been briefed by the Administration for Strategic Preparedness and Response. They've also included the Centers for Medicare and Medicaid Services, as well as Change Healthcare. Bipartisan leaders have also been included and have written to United Health seeking answers and solutions. And their findings were as follows. The lack of multi-factor authentication, or MFA, contributed to the attack. It facilitated in the absence of MFA, which is an industry standard practice for security. Next, the data leaks. An estimated third of Americans have had their sensitive healthcare information leaked. And finally, the ongoing risks. Despite the ransom being paid, there is no guarantee that further data leaks will not occur. The ransomware attack on Change Healthcare underscores the critical need for robust cybersecurity in the healthcare sectors. Millions of people deserve to have their sensitive healthcare information protected. The US Energy Commerce Committee and the British NHS and private pathology group Synovus make efforts towards understanding their vulnerabilities and ensuring such attacks are prevented in the future. However, we continue to navigate the complexities of digital healthcare, and it's imperative that we prioritize cybersecurity to safeguard patient information and maintain robust trust in the healthcare services. Thank you so much for reaching the end. If you like what you see for this insightful content, and if you enjoyed the video, consider subscribing for more. I will be doing more videos on such variety of topics such as these, but please show your support by liking and sharing the video. Thanks so much.